All right. Today's video lecture is a continuation of our Therapy and Positive Psych unit, which is Unit 5. We are focusing in on Module 5.5a, Part 2, which is all about humanistic psychotherapy.
So the first thing I want to get out there is that humanistic psychotherapy has a lot of synonyms. Some of the synonyms that you will see that are most common is called person-centered therapy or client-centered therapy or client-centered counseling. Anytime you see humanistic, person-centered, client-centered, all of those things mean the exact same thing. They are all synonyms for the same type of therapy. And when we look at kind of the father figure behind this particular perspective, we want to think of our dear friend Carl Rogers. And I like Carl Rogers' quote up here that says, "The curious paradox is that when I accept myself just as I am, then I can change." And he very much was about becoming the best possible version of yourself and supporting and creating a growth promoting environment that helps you to, just like he says in here, when your ideal self and your real self overlap and you can fully accept who you are and integrate that with who you want to be. Then you're considered a fully functioning individual and you're able to continue to grow and change. So let's just keep in mind those synonyms and that they all mean the same thing, because I will be interusing them both in class verbally, but also on any unit assessments. So the goal, humanistic psychotherapy, the goal is to promote the growth of people or clients. With the humanistic perspective is the first time they stopped calling individuals patients and they started to call them people or clients. So the humanistic perspective came after psychoanalytic, where they started to not look at individuals as patients, but as humans, as people, as individuals who need a growth promoting environment to really become the best possible version of themselves. They are very present and future focused. That's in stark contrast to the psychoanalytic, which the main focus is going back to those earlier times, finding those repressed memories and bringing them to the surface. Humanistic says, no, we need to focus on the here and the now and where we're planning on going. So it has a much more positive, growth promoting way of viewing humans. And the goal is to really help clients be heard, help clients feel safe in order to allow them to grow and become their best possible selves. They have that ability inside of them if we can just provide the environment that allows them to get there. So I always think of a flower. Whenever I think of humanistic, I think about a flower that's blooming. And a flower is going to only bloom if it has the right soil and it has the right amount of sunlight. And if it's planted in the right spot, it can grow. Every flower has that potential. And so that's kind of the belief behind humanistic, that you are able to grow if you have the right soil, you have the right environment, you have the right amount of sunlight, you can grow into the most beautiful flower in the world. It's a very positive view. So there's two particular techniques that we're going to talk about. One is active or empathic listening. Those two words are interchangeable. They mean the exact same thing. Reason why I don't know, but psychology has a lot of synonyms. So those two are synonyms for each other. And we're also going to talk about unconditional positive regard. So when we talk about active or empathic listening, it kind of seeks to do three things. Well, the big part is to give clients or individuals a place where they feel heard. And so in using active or empathic listening and giving that client an opportunity to feel heard, you want to use techniques such as paraphrasing, inviting clarification, reflecting feelings that you see or you hear a client sharing. And so the goal in active listening is not to fix what that person is feeling. It's not to make them feel stupid for what they're feeling. It's not to find out what caused that feeling or where does that feeling stem from. The whole purpose of this technique is to make a person feel like they are heard. And one of the comparisons I can think about is, think about the last time you were really upset. And sometimes when you're really upset, you want to call somebody for advice. And other times, you just want somebody to listen to you complain, or you just want somebody to hear you say what is most frustrating to you. And there's different people that you call, different friends or different parents that you might go to when you're looking for those things. When you're looking for somebody to give you advice, you're going to call one person. But when you're looking for somebody to make your voice feel valued, you're going to call somebody different. When you're looking for somebody who's going to give you that eye contact, who's going to truly hear with their body and their ears what you're saying, and they're going to encourage an environment that promotes your comfort in sharing how you're feeling and giving you an opportunity to work through those thoughts and struggles that you're having. And so we are going to work on this technique in class. And what does it look like to paraphrase? What does it look like to invite clarification? What does it look like to reflect the feelings that you see and you hear in a client? Because active listening is pretty tough. It takes a lot of energy to be able to give 100% of your body language and your listening skills to another person and to make that person's voice feel valued. It's not about making that person think that you agree with them. It's about you making their voice feel valid, feeling heard, feeling that you understand what it is that they're saying, regardless if you agree or disagree with what they're saying. So again, we're going to focus in on this in class. That kind of goes hand in hand with unconditional positive regard. It is impossible to be an active listener. Well, I won't say impossible. Very challenging to be an active listener without giving unconditional positive regard or having a perspective or a belief or a demeanor of unconditional positive regard. And remember that word that we should think of every time we say unconditional positive regard, we should think of the word acceptance. Always. Not love, but acceptance. I love this quote on this picture that says, using unconditional positive regard in parenting means loving your kid for what they are, not what they do. And so I know during personality we talked about the difference between unconditional and conditional positive regard, that do you have acceptance as long as you do what your parents want you to do? Or do you have acceptance no matter what your choices in life are, that they accept you no matter what? And I also love the other quote that says, happiness can only exist in acceptance. When you are surrounded by people who accept who you are, the choices you make, and the decisions and how you want to live your life, when you feel most accepted, when you feel most safe in those environments, you are going to become the best possible version of yourself. So that is it for humanistic psychotherapy. Have a wonderful day.
All right. Today's video lecture is a continuation of our Therapy and Positive Psych unit, which is Unit 5. We are focusing in on Module 5.5a, Part 2, which is all about humanistic psychotherapy.